Hello, my name is Dr. Dylan Remick with HealthSource Chiropractic in Baxter, Minnesota, and we have Bev with us here today.
Hello.
Who is nice enough to share her story in regards to chiropractic and how it affected her life. Bev, tell us a little bit about how you were feeling before you came into the office.
Well, I initially met you at one of those trade shows when I wanted a massage, and you wouldn't give me one.
I wouldn't?
You wouldn't, because you said my neck was so out of shape that you didn't want to hurt me, and I knew that was true. So when we set up the appointment and you you X-rayed my neck and you put my X-ray up against somebody that quote unquote is normal, and I looked at that and I thought, OMG.
You can definitely tell there's a problem.
I could definitely tell, and I had known, for a long time, but.
What did we say that made you want to come here versus just living with it like you were before?
The fact that you have not only your chiropractic and that little tool that you used on me, which was a tremendous help in relieving my nervousness, because I don't usually let people, crack my neck or mess with my back or anything, but that and the fact that you have the progressive rehab outside
made a big difference.
Made a huge difference.
What did we do or say that made you want to start treatment?
Well, you worked with me to allay all my fears, including my financial fears, because when you laid out 30 appointments, and I'm thinking, ouch, that's going to hurt. But in working with my medical insurer and so on and so forth, and that cash discount kind of helped.
It was able to alleviate some of those fears.
Yes, it did alleviate some of the fears, and the fact that I liked how you progressed the appointments from, there was 3 appointments in 1 week, and then 2, and you went for 3 weeks with 3 appointments, and then 2, and then, and as you continue to get better, because it is true that when you are hurting, you don't want just one treatment and then, come back 2 weeks later. Well, in 2 weeks, you're going through an awful lot of pain.
Yeah, healing takes time.
Yes, healing takes time, and, the 24-hour thing to kind of, let things shift back. Yep,
okay.
Exactly.
How do you feel, or how did you feel when you first came in?
I was kind of miserable, yeah. I was very miserable. My neck was definitely sore. The alignment, obviously, that is out of whack, and I was having trouble sleeping. Of course, it went all the way through your body, and my hips were hurting all night long. At work, I was having a hard time. I do a lot of filing and reaching, and actually I couldn't even turn my head completely as far as I'm doing now. I couldn't do that.
How was your arm and your hand?
My arm and my hand, I'm getting a lot more strength through it and grip.
How much was it before?
It was, I wasn't dropping things or anything, but I could tell. I could definitely tell. In writing and signing and things, all day long. I work in a legal office, and so it's like,
How do you feel now, since we've been working for a couple months now? How do you feel now compared to where we were?
I am truly about 90% better, and I'm probably for my age, I'm probably as good as I'm going to get, with my degenerative and stuff too. So I really appreciate what you've done for me so far. Thank you.
Great, thank you. What would you say to somebody that wasn't sure if they wanted to try chiropractic, if they were skeptical? Kind of like you were before, you were nervous and you were scared. What would you say to them?
Well, everybody, you got to stick your toe in the door sometime, and pain will do that. And you want to think about, okay, do I want to do this voluntarily, or do I want to do a surgery involuntarily? And the pain and the cost, I mentioned the cost earlier, but that's not your true cost is your health, and how you feel on a day-to-day basis.
Yeah. Well, listen to Bev. She knows what she's talking about. If any of you guys have problems like Bev did or questions, don't hesitate to give us a call. Our phone number is 218-454-9355. Thank you.